So you may have heard that W-sitting may be bad for children. Here's when I think you should worry, not worry, or when to ask your doctor about your concerns for your child's W-sitting. If you are new to this channel, I create occupational therapy content to uplift the profession and spread awareness about the field of occupational therapy. Check out all of my resources in the video description. You can also help support this channel by subscribing and becoming a Patreon member. I'm Jeff, the OT dude, and let's get functional. W-sitting is a very controversial topic, and it is the position that children may sit in when their knees are out in front of them and bent, and their ankles and feet are splayed out beside their hips to the sides. This creates the W shape in W-sitting. According to the International Hip Dysplasia Institute, the medical term that allows for W-sitting is called internal femoral torsion because the thigh bones has an increased twist in some people. According to Honig et al. In their article Pediatric Orthopedic Mythbusters, the myth with W-sitting, the myth is that it can cause many problems. These include hip dysplasia, hip dislocations, weakening of the core and trunk muscles, even limited use of the arm for functional abilities. Hip dysplasia is when the hip socket has an abnormal shape and becomes dislocated. This limited use in the anatomy for W-sitting is said to hinder writing, hand preference, coordination, and gross motor skills even, such as running and jumping. Parents may have been told this myth by teachers, therapists, family members, daycare staff, or even some providers that W-sitting should be discouraged. A survey was conducted and they found that 26% of parents were told that W-sitting affects a child's hips, and 46% of them believed that their children had W-sit at some point in the past. But treatments for W-sitting have also been debunked more than 20 years ago. According to the director of the Hip Preservation Program at Children's Hospital in Los Angeles, Dr. Goldstein says that there is no documented evidence that W-sitting causes problems. However, W-sitting still gets a lot of attention. Here's why I think, in most cases at least, you probably don't need to worry if your child is W-sitting. Research shows that W-sitting is a common seating position for the first decade of life, and it may even be a position of comfort. Other sitting positions, such as cross-legged sitting, may be even less comfortable for the child. Children may prefer this W-sitting position because it makes them more stable and widens their base of support during activities such as playing with their family members. Research shows that by age 10 to 14 years, W-sitting naturally resolves. Stopping W-sitting has no influence on femoral torsion, whether the hip is in or out of the socket. As mentioned earlier, many high-quality studies demonstrate that W-sitting is not associated with hip dysplasia. And because W-sitting typically resolves, there is often no recommended correction needed. W-sitting could be permitted, but alternative seating positions can be encouraged though, such as cross-legged sitting, side sitting, straight sitting, or basically any other sitting or kneeling position. Full disclaimer though, this is not medical advice and you should always refer to providers such as your pediatrician for guidance. And a recent study in 2020 published in the Clinical Pediatrics titled Hip Dysplasia is Not Common in W-Sitters found no evidence of hip dysplasia between W-sitters and non-W-sitters among 104 patients aged 10 years on average. According to another article published in 2017 in the American Family Physician, for children with femoral anteversion, that is an inwardly rotated femur bone, they often sit in the W position for more of the comfort due to the twist in their thigh bone. And if you think about it, many people often sit cross-legged, right? And this is the extreme opposite of W-sitting, in which the leg is rotated externally or outward instead of the opposite for W-sitting. So it makes sense if some children prefer the other way of W-sitting to have their hips rotated inward due to the makeup of their particular anatomy. And to give you more peace of mind, spontaneous resolution of femoral anteversion often occurs in more than 80% of children by 8 years of age. And you should know that oftentimes special shoes, braces, connective bars, and other orthotics have not really shown to be effective. And in Dr. Goldstein's x-rays of children who W-sit, they found no signs of hip dysplasia. She believes that how much children W-sit does not really make a difference and overall is not really much of a concern. This is not to say that W-sitting is not associated with other problems completely. You can think of W-sitting as a risk factor or predispose children for other conditions if they have them, such as for having flat feet when walking. Research has shown that children, especially boys who are obese, who have increased joint laxity, and who often W-sit, may have an increased prevalence of flat feet or a decreased foot arch. Although flat feet may present some difficulties such as with prolonged walking, it is somewhat of a common condition in younger population and typically resolves by adolescence. So what should you be more concerned about? The concern really is if your child shows functional deficits in other activities or areas. They have a developmental delay, a pre-existing condition that may affect their neuromuscular function, or if they are not meeting their major milestones. If children miss major milestones, such as walking, change the way they walk, such as with a limp, weakness, are pigeon-toed, have difficulty with fine motor tasks for their age, are clumsy or uncoordinated, or they have other functional limitations that are expected of that age, then you should talk to your pediatrician about your observations and concerns for further interventions such as occupational and physical therapy. Hope this video helps with some of your concerns about W-sitting. If you found this video helpful, give it a thumbs up. I'm Jeff, the OT Dude. Thanks for watching and have a nice day.